May I welcome you to our meeting. I believe you are familiar with our rules. Now that is this is a earpiece. This is assists you with the hearing. Channel 0 is floor channel. Channel 1 Cantonese. Channel 2 English. Channel 3 Putonghua. And you may ask the assistants to help you. And we have a speaking order. Each one will be given 3 minutes. Your speech here is not protected by Legislative Council Powers and Privileges Ordinance Cap 382 of the Hong Kong laws. Your submission is not protected either. Your written submission is also not protected either. As you all know, we have the guidelines or instructions for those who attend our meeting and those who are in the public gallery. That's for security purpose. Now, a copy has been given to you. We will ask the administration to give a brief introduction. Maybe the expert can also say a few words. They will speak for about 5 minutes, just like the previous session. So each one of you will be given about 2 minutes or so. I mean the official and the expert. And then the deputations will give their views then. The PAS or Dr. Choi. Chairman, we are glad to participate at the meeting organized by the panel so that we can listen to the views on the Elderly Services Program Plan. We are grateful. I and my colleagues will listen very carefully. The program plan is a result of aging population. We need to adjust our service, enhance our service to the elderly. In 2014, in its policy address, the CE responded to people's call and asked the Elderly Commission to draw up the Elderly Service Program Plan. Our work is divided into 3 stages. First, scoping, then formulation, and then consensus building. We are now in stage 1. We are now drawing up the scope. In each stage, we will consult the public and the stakeholders so that our work can cover the views of different sectors of the community. We had several consultation meetings or focus groups in October to November last year. Dr. Choi and his team organized these focus group discussions and received views. We've also received written submissions. We have already heard 24 groups this morning, and we will continue to listen to your views. I believe that that will be very helpful to our work. And in drawing up our proposals, we will consult you again. Dr. Choi. Thank you, Dr. Choi. I invite the groups to give their views. The first is Ms. Chu Moon-chan, member of 照顧者關注組. RCHE and other care services are much needed. People's need has far outstripped the government's provision. The government tends to shirk its responsibility and find excuses to privatize the much-needed service.
The government is not compassionate enough. It disregards affordability, whether or not the fees and charges are reasonable. All fees and charges are based on demand. We do not have sufficient subvented RCHEs. That's why many turn to the private sector and are forced to receive poor services. As a result, the health and safety of the elderly are at stake. And the government has passed the buck to the private sector. The government said that it is regulating the board places, but the regulation is not enough, and the scoring scheme has further divided the persons who need the services. The government has disregarded the needs of the patients in need. We actually consider that as a downgrading of services. For example, when an elderly person cannot take care of himself and family members need support from the carers, very often they have to queue up for half a year or so. And meal delivery services are important for those with minor weaknesses and disabilities. Still, the government has provided a downgraded service, and the users are forced to go to the private sector. Even with vouchers, they have to pay a high fee. And for those with better health conditions, they're not given a place in the RCHEs. Only those who have serious disabilities and weaknesses can queue up. This voucher scheme is actually to benefit the private sector such that they can make a profit. This is not for the benefit of those who need the services. So what's the role of the government in society? If we want the elderly persons to lead a comfortable twilight life, we should have a long-term service timetable for them. $5 billion have been set aside for the elderly persons who have contributed to society in the past. There shouldn't be any means test for carer services. Next, Mr. Chang Kai-ping from 葵涌邨居民權益關注組. Good morning, everybody. As our population ages, we now have more serious structural problems. So we must provide appropriate arrangements for the elderly. But all these years, the government has not been doing so. It has always claimed that resources are limited. That's why the government is not offering services. The elderly persons have to wait for a few years for residential services and 2 years for meal delivery services. So some elderly persons pass away before getting the services. The government claims that it has a social responsibility towards these elderly persons, but the government has not been honoring its pledges. So I'm extremely dissatisfied with the government. In particular, the CE's policy address is particularly unsatisfactory. So here I'd like to ask for more resources to take care of these weak elderly persons with nobody to rely on. I hope society can help them. I think there shouldn't be any means test for a universal retirement protection scheme, which will be helpful to the elderly persons, to society, to the elderly. Such will be very helpful. Thank you. Next, Elderly Welfare Concern Group, Mr. Lai Ming-lai, the member. Thank you, Madam Chairman. At the beginning, the official said that Hong Kong society is aging, but I don't understand one point. Why is it that the government is only exploring planning issues now? Secondly, the government has grasped a great deal of data. It depends on how much data the government is willing to disseminate for discussion with the public. For healthcare financing, we started a consultation exercise, and now we see a review, and there will be another round of consultation, be it elderly services, healthcare services, or housing supply. The government is commercializing these services. Now, in this paper, one concept is mentioned, that is, money should follow the person. That sounds good, but in fact, the government is pushing the service recipients to hell. Different institutions may offer services under different names, but different names mean different services. Some grassroots kaifongs cannot be served. This is not the first time we're talking about aging in place. All along, the government has been publicizing the concept of aging in place. But insofar as services are concerned, we won't be able to allow the elderly persons to age in place. So we need to patronize the private sector. We have to purchase services from them. At the community level, at the district level, there's insufficient coordination. The kaifongs, we know, have to wait for RCHEs. They have to undergo means tests, but after waiting for many years, they're still not getting the service. You have to wait for a few years. If you want specified services like escort services for medical consultation, if you want meal delivery services, sorry, if you specify what services you need, you don't get them. If the government is really dedicated to this, please look at community needs and look at the actual circumstances of the elderly in conducting your review. Next, 工友權益聯社 Ms. Chang Man-wai, the member. Thank you, Madam Chairman. I very much agree with the preceding speaker. Yes, there was this case with an 80-year-old gentleman who was rejected by an RCHE. He is suffering from dementia. His wife is also 80 years old, so we're talking about this couple. He was hospitalized. Upon discharge, the medical social worker said that he had to wait because it's not yet his turn. So he was given a whole list of private RCHEs. His daughter studied the list and found one. She paid $9,000 a month. But then, in a few months' time, that private home drove the gentleman away because he had been engaging in violent behavior. Yes, the money goes with the person, and if you offer the money, services should be provided. But sorry, that's not happening. We now have more and more dementia cases. And now, for this residential care home, charging $9,000 a month is rejecting this dementia patient. We previously had a green paper on elderly services. For those elderly who have nobody to rely on, they must find a residential care home. In fact, the government has a great deal of money, but the government is doing nothing. The money is channeled to private homes, but the service standard of private homes vary. Now you have 13,000 squatter huts previously. You dare not demolish them because you don't have enough housing units. When you have enough housing units, you demolish these squatter huts. It's the same is happening to the private homes. There's no regulation and supervision. And these private homes cannot provide appropriate services to the elderly. So how can we go on like this? You have to go back to the fundamentals. What sort of policies do we need? We need a people-oriented policy, not a money-oriented policy. You continuously say you want people to age in place. But then when the elderly have to queue up for services just like queuing up for housing units, these elderly will wait and wait till their death. And eventually you ask the elderly and their family members to settle everything. And when they can't settle everything, these elderly people have to die at home. Our team is here. During the last consultation exercise, we already had these views. On that day, nobody answered our questions. What will happen to that gentleman? So don't just look at money, please. Next, Grassroots Development Center, Mr. Ng Kin Wing. Thank you, Madam Chairman. We've come many times to discuss the same topic. We submitted a lot of papers. What is the view of the government? Since we're on scoping, let's talk about the fundamental principles. You have to sustain the elderly before they can age in place. And the fundamental problem is that you should respect the elderly. Don't formulate policies that adversely impact on our elderly. Our elderly should live in dignity and comfortably. What about ancillary services? Financially, we've been talking about universal retirement protection for many years, but the government is claiming that there's no consensus. Mismatch of policies, we mentioned a lot of times. Housing, medical and healthcare services, community services, etc., etc. Very often they're mismatched. Finally, social responsibility. The government should not pass the buck to the family members and ask the elderly to age in place. Do family members get more support? That's more important. A few years ago, we already said that we must formulate a long-term elderly services program. Today's Hong Kong faces an aging population. We also face serious poverty. The elderly are both old and poor. They say that they are poor, old, with no support and help from their children. So they want the government to help. The service vouchers won't help. You're just passing the buck to the market. So the public cannot accept this. We would like to propose some fundamental principles. To age in place, we must have a universal retirement protection scheme. When the elderly persons have money, they can choose to age in place or to stay in RCHEs. So please attach importance to this. To age in place, the grassroots say that they may age in place, but in stupidity. For an elderly suffering from a stroke, how can he age in place? And how can you ask family members to take care of stroke patients? Secondly, we'll oppose any means tests. The elderly have contributed a lot to society. At the end of their life, why should you be so calculative towards them? In the long run, the elderly policies must take care of rehabilitation, care homes, and all aspects of the life. I'll go into the details on another occasion. Next, St. Francis Church Caring Committee Senior Group, Mr. Wong Kang-san, Caring Committee.
Thank
you, Chairman. The government divides the elderly into young elderly, medium elderly, and old elderly. But for the service providers, they provide service to the elderly living alone. They provide outreaching service, but because of shortage of manpower, when an old elderly has an emergency situation, then the elderly cannot rely on the service provider. Many medium elderly are just sitting in the park waiting for sunset, and many young elderly are deterred by the fees and charges when they when they want to buy service. The elderly services provided to the elderly are not coordinated, and the services are insufficient. Now, if the government is aiming at active aging, then you can make use of the resources of the young elderly and the medium elderly to serve the old elderly. If some incentives can be provided to mobilize the young elderly and medium elderly, then they can regularly or even daily visit their old elderly neighbors. There will be care by neighbors, and this will help to address and reduce emergency situations. This will help to build a neighborhood spirit. This is also an opportunity for active aging. If the government is willing, that will help to reduce the chance of accidents. Now, it is said that there aren't enough home carers. The government should help find ways to increase resources, to increase the number of home carers. Say, NGOs can be funded to recruit housewives to provide care service to their neighbors. This will help to increase the number of carers for elderly. They can participate in caring for their neighbors within the community. Now, many young elderly or medium elderly do not participate in paid services, do not buy paid services. I think some quotas should be provided to them free of charge or with a subsidized fee. Finally, on retirement protection, the government should deploy resources and also juggle its tax policy to do that. Next, Madam Wong Pek Yan of the St. Francis Church Caring Committee Senior Group. Now, there are three issues. First, the medical voucher. Second, carers. Third, retirement protection. First, the medical voucher. It is given to the elderly aged 70 or above. We start to work in our 20s, and when we retire at about 60, we have no income. By then, there is no health insurance, and there is no healthcare voucher. And we have to wait for 10 years before we get the healthcare voucher. Now, we contributed to community. We serve our family, but we have no benefits after we retire. When after we retire, we have a lot of illnesses. Now I worked 3 jobs, and then I worked in a factory during the day, and I also go to work in the evening, and also I go to study. I went to study. I live in Maonshan. I worked in Taiwan. When I return home, it's already very late. We came in the 70s. We were new arrivals. We were new immigrants. We worked hard. I was an ordinary, I was just a junior staff, but I was raised to the management level. I retired at 60, and then I don't have any healthcare benefits. Now, when I was working, there was health insurance paid by my employer, but after I retired, I was not covered by medical insurance. Now, I raised 3 children. I spent all my money on sending them to universities. Now, I am of poor health, and I have not much savings. Is it my responsibility or the government's responsibility? I think it's half and half. I think there should be a healthcare voucher for the retirees, starting from age 60. As for the scope of the healthcare voucher, healthcare services, we have to find out which doctor is in the healthcare voucher scheme, which doctor is not. It's really complicated. And if we go to a government hospital, we have to wait for a very long time, sometimes half a year, sometimes 2 years, 1 year, 2 years. The healthcare voucher, the amount of healthcare voucher should increase to $3,000 per year. As for healthcare service for the, as for daycare service for the elderly, I hope there can be respite service, and there should be be improvement to barrier-free access. And finally, retirement protection. The OH allowance, the OALA, and retirement protection. Now your time is up. I think we need $3,000. And yes, that's very clear. Thank you. Next, Mr. Yang Shepto, Vice Chairman of Hong Kong CSS Specialized Committee on Elderly Service. Yes, please speak. Your mic is on. Thank you, Chairman. We support the program plan that is outcome-oriented. I think the plan should deal with 6 areas. First, there should be service standards, objectives, targets, and review mechanisms. 2, review the service outcomes at present. 3, reform the service and also coordinate future services. 4, from point of view of service users, there should be quality assurance. 5, the government should not dodge the issue of financing for long-term care for the elderly. 6, adopt a shared responsibility principle. There should be private and public partnership in provision of service. Individuals and families should take up responsibility for long-term care. In the planning process, there should be long-term professional development for long-term care. The focus should not be on all administrative problems. Otherwise, it will only create further long-term care problems. Financing for long-term care is important. There should be interaction with the trade and participation by the public. There should be a mechanism so that the consultation is really two-way. There should be coordination and participation among government departments and bureaus, and transparency should be enhanced. There should be greater partnership and mutual trust. Thank you.
香港明愛社會工作督導主。
Next, Mr. Leung Chan Kyun, Caritas of Hong Kong. I want to speak on long-term care policy, and there are 5 points. As for elderly using long-term care, they should be based on 3 criteria: the physical deterioration, family situation, and special needs. And there are many elderly who are suffering from dementia. The assessment tool is not able to deal with dementia. There should be a review on this. The government has a responsibility to establish a mechanism that is open and fair. Elderly who have the need can join the system of long-term care. The system should be monitored carefully. We propose to set up a long-term care service, a long-term care office, to do more systematic planning. We need to consider the situation of the carers for the elderly. The support given to the carer is very important. The government should provide substantial support. There should be a policy on helping the carers. As for welfare institutions, there should be more service units, and adequate manpower should be provided to service institutions to keep pace with rising demand and expansion of service. There should be better communication with the NGOs to better use land. The roles and method of cooperation should be delineated. The government should do manpower planning for caring service to make sure that there is adequate manpower to deal with rising demand. And that includes frontline service workers, not just nurses or doctors. There should be coordination between the welfare sector and the healthcare sector. There are differences in pay, differences in remuneration, so that some of our colleagues just work in the hospitals and don't work in the elderly care service. There should be better coordination. The administration should consider the above 5 points to formulate its long-term care policy. Thank you. Next, Ms. Lee Kit-Cheng, Supervisor of Hong Kong Young Women's Association. Thank you, Chairman. I will speak on case management. The number of elderly receiving long-term care is increasing, and that is a centralized assessment mechanism. The data are now kept by the Central Assessment Office. The government should collect data on the need for long-term care. There should be systematic analysis of such data. The data collected by the Centralized Assessment Office should be analyzed so that a policy can be formed covering social development and also providing support to planning and financing. The government should disclose long-term care clinical data for the welfare and healthcare sector's reference. And there should also be better coordination at the local level. The government should address long-term care needs and deal with long-term manpower planning. There should be a case management system, and there should also be professional requirements for the service providers. And there should be objective assessment. The government should work with stakeholders on code of practice for case management. Procedures, protocols should be established so that there can be comprehensive and professional development for case management. Case management mechanisms should be authorized by the government, and manpower resources should be put into case management. There should be coordination, different professional teams to provide service.
Resources should be provided for implementing case management work plans. To have good case management, we need supervision and procedural requirements from the government, and we need to have resources. Friends, I'm afraid that some of you may have to leave early. Just now when I went through the papers, I discovered that many deputations and individuals did not submit written papers to us. So if you haven't done so, please pass your papers to us. Next, Evangelical Lutheran Church Social Service Hong Kong, Mr. Swing-Jia Wong, Service Director. Madam Chairman, I'd like to say something about dementia. At the moment, 10% of the elderly have dementia, and every year we have 18,000 cases. By 2036, the number of patients will increase to 280,000, fourfolds as of now. So that will exert huge pressure on the sector. So all those providers providing services to dementia patients should improve their equipment and facilities. And those who need home carers should improve the facilities at home. So home design and guidelines on home design should be promulgated to suit demented patients, demented elderly. And we must have long-term policies for them. And then on the basis of service needs, a manpower ratio should be formulated. Systems should be established such that carers can receive professional training so that services provided by them are professional enough. And just now some speakers said that demented patients have behavioral problems. These don't just happen in residential homes, but also in daycare centers. It's rather common. When an elderly contracts medium or serious dementia, there will be behavioral problems, and very often the caring teams won't be able to cope. We would like to establish We would like to set up daycare centers for demented patients with cognition and behavioral and emotional problems. Apart from supporting dementia patients, we would like to support daycare centers, home care services, as well as RCHEs. We can teach them how to handle demented elderly with behavioral problems. We would like to set up one special daycare center in each district, such that there will be strong support for service providers so that they can handle problems. I hope that this panel and the government can pay attention to the 2012 strategic plan by the Hong Kong Council of Social Service for 2012 to 2017. A comprehensive report has been published, so may I refer you to the views therein. Next, Sheng Kong Hui Holy Carpenter Church Community Center, Mr. Shan Wai Chun. Good morning, everybody. I'd like to share with you two expectations. First of all, the services provided by Elderly Center should be more preventive in nature. At the moment, they're mainly taking care of healthy elderly and elderly with physical weaknesses. For these elderly centers and neighborhood centers, if they can strengthen their district services and provide more support and preventive care, it will be very helpful, particularly for the high-risk elderly. And this is to reduce the need for long-term care, as well as the pressure on the carers as well. These centers can enhance their equipment to do health promotion services by teaching preventive measures, self-help procedures, simple tests, etc. Then the elderly will have a healthy life, and the demand for elderly services will also be reduced. Secondly, every year 40 to 50 people die in Hong Kong. 80% are elderly people. So hospice care and service are in huge need. You have to face this seriously. At the moment, we only provide hospice care and services in hospitals. What we want to advocate is that we should enhance community hospice care, including how RCHEs are to provide hospice care and how families are to provide hospice care at home. For community hospice care, it should match our elderly policies such that at the end of their life, the elderly can, in a home, in a residential care or home or in their own homes, receive proper hospice care and services. This is even more cost-effective. Thirdly, this is to reduce the chance of the elderly having to go in and out of hospitals and to ease the pressure on family members. So hospice care should be enhanced. You should teach family members how to take care of elderly members at the end of their life, and then you should also prepare the elderly and their family members to prepare for the end of the life of the elderly, such that the elderly won't just age in place but also die in place. Community centers can provide hospice care education to strengthen the ability of the carers in taking care of the dying elderly. Communication should be enhanced in mapping out the arrangements after death. Next, Hong Kong Association of Gerontology, Ms. Chang Yuk-ha. Mr. Chairman, we have roughly 4 points on the Elderly Services Program Plan. Concerning consultation, this plan will impact hugely on the service industry. So apart from broad consultation, there should also be regular consultation with the sector, the lay organizations, as well as the professional bodies. You should not neglect important opinion. And then for elderly services planning, the government should have short, medium, and long-term planning for the next 2 decades. And for support services for the care homes, you have to set indicators. This is a must. For the assessment mechanism, we agree with the profession that for so many years, we have accumulated information for 200,000 cases. Now, such information should be passed on to the profession on a regular basis so that the profession can provide professional opinion to the government. In the past few years, together with the Macau government, we have set out an assessment mechanism as well as a review mechanism on various fronts. We're prepared to discuss this with the government. As for upgrading service quality, the licensing requirements should only be the basics. To enhance service standard, the government must subsidize the profession in participating in the assessment mechanism. As for manpower shortage, this is a fact. In 2013, the Hong Kong Council of Social Service conducted a survey on manpower resources. At that time, were 1,000 workers short. As services grew, for basic services, we may need an extra 6,000 posts. So we suggest that the government do something about the frontline and professional workers for the sector, and there should be professional training. For the healthcare workers, they have to be registered. We only have registration requirements at the moment, but these healthcare workers are essential to the profession. Knowledge and skills must match. We would like to add in a renewal and revocation system, as well as a promotional ladder in order to retain the professionals. This year, we set up a network for job seeking so that employers and employees can make use of the network to fill posts. Well, please leave your paper with us. Next, Hong Kong Shang Kung Hui Welfare Council Limited, Ms. Luk Loi Tai, the Service Director. Thank you, Madam Chairman. I have 4 points to make. First of all, about the ordinance on RCHEs. At the moment, the regulatory regime covers only RCHEs. For licensed RCHEs, they shouldn't serve as infirmaries. Otherwise, they have to take out an infirmary license to make sure that suitable services will be provided to the elderly concerned. So I suggest that the government unify or standardize all licenses such that service providers don't need to apply to the SWD and the Department of Health separately for different licenses. And we want a single license regime. Of course, the SWD can determine the manpower level to be provided to make sure that licensing requirements are met. Number two, the government is duty-bound to specify and regularly review the standard manpower level for different services, particularly at the basic level, at the junior level. Depending on the health conditions of the elderly served, the manpower ratio should be determined. This is to ensure quality as well as suitable service. As for elderly receiving CSSA, some of them may go to RCHEs, and some RCHEs charge them in accordance with the amount of CSSA the elderly receive. Now, CSSA is funded by the public coffers, so you have to work out the service standards. Just now, some speakers mentioned accreditation of RCHEs. Now, you must set a uniform standard. As for home care services, they should also be put under a lump sum grant system. Then we don't need to have competitive tendering exercises every year. And all along, we only need one set of regulatory requirements. At the moment, it's rather confusing. So if you can integrate home care with residential care, it will be better.
Next, Madam Fong Miu Ha, member of the 長者政策監察聯席。 we asked the administration to put resources to build a case management system. Those frail elderly who are not covered by the mental health ordinance will be helped by a case manager. The case manager should be a professional in terms of providing healthcare services, a social worker or a nurse. They can help the frail elderly to choose a suitable RCHG. They can also visit the elderly, even if the elderly don't have family members to look after them. The elderly can express their needs through the case manager. The case management system can also provide information to family members, enhance the knowledge of family members so that they can monitor the provision of service. The second point is on CSSA and long-term health care. The two should be separated and coordinated. At present, those who receive CSSA payments, the payments are for basic living. When the elderly are hospitalized or when the elderly are living in a private home for the elderly, the CSSA will not be adequate. The elderly don't even have any pocket money. They don't even have money to buy a loaf of bread because all the money are paid to the private home. The elderly should be given the right to active aging. Their demand is just very humble, just to buy some poor tea leaves or just to buy a loaf of bread. When they are weak, they have long-term care needs, and they should be given additional long-term care subsidy, which is different from CSSA. CSSA only for basic living. The disability is assessed according to a centralized mechanism, and the government can decide on the amount of subsidy basing on the degree of disability or degree of frailty. This is an objective assessment. Thank you. Members, we have decided to extend our meeting by about a quarter of an hour. Some groups still have to give their views, and we still have to put questions to the administration. So our meeting will be extended by a quarter of an hour. Next, Mr. Pang Fai Hang of the 香港基督教服務處長社評議會. Thank you, Madam Chairman. We have three expectations. The government should increase the transparency of information, help elderly and their family members to have better understanding and make early arrangement for care. The elderly are concerned about the waiting time for different types of services. They want to know the scope and also a geographical distribution of home care service or community care service. The waiting time, the progress should be, and those related data should be updated, uploaded to the internet so that the elderly and their family members can be informed and make suitable arrangements. There should be a centralized office to centralize the data so that the elderly can approach such data center for information. As for means tests, will the administration consider a service based on user pay, and what kind of service is subject to means test, what kind of service is not subject to means test, what kind of service is basic service, which doesn't require means test, and how is the means test conducted? Is the means assessed according to a family or according to an individual? All these have to be explained and have to be thought through. There should be suitable coordination of services of helping the carers, and there should be adequate respite care service. Next, the Salvation Army Yamate Multi-Service Center for the Senior Citizens. Team leader, Madam Chu Pui-san. I will speak on policy on carers. The carers play a very important role on caring for the elderly. We propose taking a leaf from overseas experience. There should be a subsidy for carers who care for the elderly. They will be given an incentive to stay at home and care for the elderly. The major carers in Hong Kong are mainly females. They play a role in caring for the family, and they are not remunerated. They don't go out to work. There is little economic security or financial security. These women are suffering from heavy pressure. There are many male carers as well. According to our recent studies, men adopt a problem-solving approach in caring. They do not express their feelings or their needs as a carer. We propose that the government should conduct more detailed studies. The CCF provides a carer principle to low-income families. The carers are given a subsidy, but the number of recipients is very small. The government should conduct a more detailed planning on providing subsidy to carers. Many cities or countries attach importance to supporting carers. The government should take a leaf from the experience of these countries, and the government should introduce a carers allowance. This will help to reduce the demand for public service of these families by these families. The carer is no longer regarded as providing free service because the government will provide a subsidy. In 2010, the Salvation Army conducted a survey on elderly care service, opinion on elderly care service. 70% of respondents supported aging at home. They supported a carer allowance, which is not means tested. Subsidy should be given to the elderly to buy consumables. The government should work with the community, draw up a policy that is suitable, and try to make good use of the carers. The government should learn experience from overseas countries. There should be two objectives. Help the carers so as to reduce their pressure, give them some compensation, support the employment needs of the carers. The second point is that in the labor market, the government should make use of the untapped manpower among the females. Next, Madam Lui Kwok Ying, Clinical Practice Leader of the St. James Settlement. Aging population leads to rising demand for long-term care. Society has to face up to that, just like education, security, health care. This is a shared responsibility between the government and the community. The government has raised many issues for discussion in the area of healthcare financing. I think the government should also consider financing for long-term care. 90% of the service providers are financed by the government. 37% subvention to NGOs. 11% bought place from private homes. 41% through CSSA payments, paying for living in bought place scheme, living in private homes. The government revenue comes from tax. Population is aging. Can the government maintain its subsidy or to long-term care? That's questionable. In Japan, Germany, Korea, and even Taiwan, they have been doing long-term care insurance, and some of them are considering this. Now they have already got medical insurance. They don't want to leave the hospital, and they do not want to live in fee-charging long-term care homes. Though they are not sick, and they still stay in hospitals. We need to consider financing for long-term care. We should understand the expectation of the elderly towards long-term care and long-term care financing. The government can raise direct tax such as salaries tax to increase the revenue for long-term care. The people should be encouraged to buy long-term care insurance, and the premium can be the basis for tax concessions. There should be universal retirement protection. The amount should be adequate to pay for health care and also long-term care. Individuals and governments and the government have the duty, and also the employers also have duty to contribute, so that this is a shared responsibility. This is a sustainable scheme. As for receiving service, that can be a kind of cash, service in cash, so as to buy service from the market or from service providers. The such mental state of the carers are also important to the quality of care provided. Respite care is also needed. In introducing community care voucher, it should be allowed to buy respite service, so as to reduce the burden on the carers. Next, Madam Leung Choi Kam of 天水圍長者權益關注組 or Elderly Rights Concern Group of 天水圍. We hear from time to time that elderly are waiting for community care service. They have been waiting for a very long time. The government should set service targets or waiting time targets, so that the elderly can understand their own situation. The government should set also the waiting time targets for the provision of home care service. I think the waiting time should at most be 17 or 14 days. The waiting time for home cleaning should be at most 1 month. Meal delivery should be 2 meals per day, and personal care, it should be provided at least on alternative days, and home cleaning service no more than 2 hours per week, no less than 2 hours per week. The government spent 2 years on elderly services planning. Will the administration publish a timetable and a route map?
The ultimate content of the study report, will it actually be implemented? If not, why should you spend money and time just for the sake of dragging the issue on? I would like the officials and the consultant team to explain this. Thank you. Next, 關注家居照顧服務大聯盟 Ms. Chim Mew Chang. Thank you, Chairman. In fact, after listening to the speakers of Session 1, I very much agree with them in terms of home care. I'm actually a weak elderly. After being discharged from hospital, after an injury, I also found myself helpless. I'd like to thank my family members and siblings for their accommodation. Now, I do come into contact with other elderly people in my district. They have also gone through the period of young elderly, middle-aged elderly, and old elderly. They don't have home cleaning and meal delivery services. I would like to say that I really want these elderly to have physical and mental health as well as a healthy living environment such that they won't contract diseases. Otherwise, they will age even more rapidly. You should assist them to adopt preventive measures. Then, future caring and health care expenses won't be so huge. In fact, many family members of the elderly want to have home care, such that the elderly don't have to leave the home environment which they're so familiar with. We should have somebody to visit the families and the elderly members so that they know, they understand that there are such services. In fact, what I want to say is very simple. Thank you very much. Thank you, Ms. Chim. Next, Hong Kong Family Welfare Society, Ms. Wong Kit-yu, their Senior Manager. Thank you, Mr. Chairman. I would like to present 2 points about home care services. I would like the government to have a comprehensive review on the ordinary cases of home care services. Since 2003, the government has not conducted any review. We still have 60 teams, and the annual subvention cannot catch up with inflation. We've not been subject to a standardized assessment for any new cases. The physical and mental handicaps of these elderly have not been assessed. All cases can be covered by our service. But in many cases, the elderly concerned are already very weak, and the resources and manpower that we invest into these causes were huge. So you should have a comprehensive review, perfect the assessment mechanism, and clarify registration requirements. And you should have a case management system to take into consideration changes in the elderly population in terms of age, disabilities, weaknesses, etc., so that daycare centers can provide seamless services in the community care program. Number 2, enhanced services. These have been in place for over a decade, but they've not been put under regular subvention programs. Every year we have to compete for resources. We got wastage in manpower, and assessment has to be done afresh every time. So it's a waste of resources. It really depends on whether the elderly concerned know the service provider, the personnel involved, etc. And personal health care is very often involving privacy. So stability of the service providing team is very important. So it's very difficult for the elderly to get adapted to new service providers. So we would like to have a better monitoring system. The government should, as soon as possible, include these services under the regular program, such that we don't have to have a re-tendering exercise in 2017. Thank you. Next, Civic Party, Ms. Vicky Chiu, the district developers. The aging problem is important. According to the census and statistics, in 2013, above 65 years old, we have 14.2% of them, over a million. We'll see a growth of 32% or 2 million people in the year 2040 or 41. All along, our elderly services are fragmented. Different departments operate independently. Therefore, in terms of quantity and quality, our services have not been able to meet demands. Our elderly are not sufficiently protected. The Civic Party asked for a comprehensive elderly services program with long-term planning. Certain factors should be considered. First of all, there should be an interdepartmental working group to coordinate elderly welfare, residential care services, aging in place, etc., to meet the planning demands in the next 2 decades. And we must have a long-term community care program such that we're not subject to age constraints. There should be coordination among departments to improve on the fragmentation approach at the moment. Number 3, we should increase the number of residential places. At the moment, we have about 23,000 RCHE homes, 3,000 subvented places in subvented homes. Subvented homes, self-financed homes, or contract homes all have bought places, and also residential places under the enhanced bought place scheme. But we have almost 30,000 elderly waiting on the waiting list, and the waiting time is as long as 36 months. In 2013, we have around 5,700 elderly dying during waiting. In this year's policy address, the CE promises that in this term there will be an additional 5,000 residential places, but this is just a drop in the ocean. Therefore, the Civic Party urges the government to, as soon as possible, increase the number of residential places, shorten the waiting time, and reduce the possibility of the elderly passing away before getting a residential place. Point number 3, the government should implement a universal retirement protection scheme as soon as possible. Aging is an unavoidable problem. Professor Nelson Chow has completed a study report, and in this year's policy address, $50 billion have been set aside for retirement protection. No tax will be increased, we propose. No contribution on the part of employees. That's what we propose. Sorry, time's up for you. We've read your paper, so thank you very much for your remarks. Colleagues, for this session, I don't intend to allow the administration to immediately respond. We've only about 20 minutes left. I would like to know how many colleagues would like to speak. We have 5 speakers, roughly. 5 minutes per speaker, covering questions and answers. Well, I may let the government have a few minutes to round up. Here I have to say that the Deputy Chairman and I have moved a motion. This is already the amended one. Please pay attention to the amendment. This panel urges the Elderly Commission to expand the scope of the Elderly Services Program Plan and urge the consultant team to broaden the scope of the study to cover the living needs of the elderly after retirement in terms of social welfare services and medical and health care services, as well as retirement protection. So none of you will leave early, right? So I'll handle the motion later. Mr. Leung Kok Hong, Ms. Chen Yuen Han, Tang Ka Piu, Frederick Fong, and I would like to speak. Mr. Leung Kok Hong, 3 minutes. Mr. Chairman, well, the budget is coming this year. Do we need to filibuster again on this universal retirement protection issue? I really don't know. We filibustered to strive for universal retirement protection, but filibustering is an exaggerating term. We just want to strive for some sort of a living subsidy for our elderly. That subsidy won't be able to take care of all aspects of the retirement life of the elderly, whether it's $3,000 or $4,000, or you model on overseas jurisdictions by having a retirement insurance scheme. You're only offering a subsidy only, not all of the expenses. When there are special circumstances, the quality of life of the elderly may be further affected. Our elderly have to rely on the MPF, their own savings, the government's CSSA, or the future annuity system. For the final stage of their life, we would like the government to make proper arrangements for the elderly, but the government lacks sincerity, as I can see. In C.Y. Leung's policy address, his perspective is even worse than that of an ordinary person. If an old person is sick, if his physical and mental capacities weaken, then apart from dipping into his own pocket, can we have some non-cash payments by the government? That is, to provide a universal retirement protection program. Well, the government wants the elderly to age in community or age in place. But if we're not providing enough for the elderly, that won't work. I think you should allow the elderly to have a choice. Well, don't pass them to community care if they can't get residential care. So they should be given a choice. Next, Deputy Chairman, Ms. Chen Yuen Han. Mr. Chairman, on your motion and my amendment, I heard from 2 deputations a very crucial issue. That is, for aging in place. Ever since 1997, what has the government done? Has the government been adopting a piecemeal approach only? This is such an important issue. The government has commissioned a professional team to study the issue, so the government should not set restrictions for the study team. Otherwise, it is a bogus study. That's why, Mr. Chairman, I suggest we add in housing needs as well.
話俾大家聽，即係起碼就話你話俾我聽係咪達到？
The government has to tell us whether it's going to achieve these three objectives: aging in place, elderly being supported, and active aging. What are the problems blocking your way in achieving all these? Now the groups have come to speak on the problems arise in respect of elderly services. If you are going to study, conduct a comprehensive study, then I want the PAS, the Permanent Secretary, to tell us whether this is just a consultation in name only, or is it a genuine consultation? I'll give you 1 minute to answer my question.
嘅意見啦，同埋提問，其實咧，我哋今次嘅
Thank you, Chairman. Thank you, Vice Chairman. We have spent a lot of time considering the Elderly Services Program plan, and then we responded in 2014. This HKCSS has made a number of proposals and submitted a plan. Now, in our paper, in paragraph 5, in the paper we gave to the committee, we said that paragraph 5, we said that we would like to do a comprehensive plan on elderly services program plan. Let me speak this. Elderly services. In fact, many have spoken on home care for the elderly, but you have many rules and constraints. You have many contract terms, and the NGOs are bound by such terms. You really need to set targets, and you really need a comprehensive plan. Otherwise, you cannot really meet the needs of the elderly. Okay, time is up. Next, Mr. Tan Kapio. Thank you, Chairman. Concerning the motion by you and also by the Vice Chairman, it seems not problematic. We need to care for the welfare needs, the medical care needs, and the needs of the arising from the retirement life. We really need to know the needs of the elderly in the coming 5 years, 10 years, and 20 years, and how such needs are met. My concern is that you are not able to come up with what actually these things are and what these needs are and how such needs are to be met. Now you say aging at home is the principle, and then supported by institutions, and supported by residential care in institutions. Now the support provided to aging at home is very limited, and the waiting time for residential care homes is very long. We have heard serious cases. Many service providers want to have more certainty. They want to have a more stable contract instead of having the need to bid for a contract within a short period of time, again and again. Can you explain to us how you will increase your efforts and increase resources for elderly services? The CE has tasked the commission, the elderly commission, to complete the plan in 2 years. After we've collected the views, then the commission will set the targets and priorities. Mr. Tang's concern is about the projection on subsidized service. Now that's in B. The Commission will take stock of existing and planned elderly services. Now, will you, in the budget, increase the resources? You don't need to wait for the report. Will you do that? That's a good question. We don't need to wait for the report. We have not suspended all service waiting for the report. The program plan is for planning, and we keep enhancing and improving our services. Mr. KK Fong. Sorry, speaker is not coming through. There aren't enough community care service. There aren't enough residential home places. Nothing is. You have not provided any. You have not provided adequate resources. That's why we ask you questions. But when we put questions to you, you say you have this service, you have that service, but none of the service is adequate to meet the demand. And when we ask you to do something about it, you say you conduct a review. But isn't it your duty to conduct a review from time to time? Several thousand elderly have died while waiting for service. Do you really have the commitment to do it? If you have, then you should require all public buildings to earmark a certain floor space for institutions for the elderly. Just look at the lobbies of the government departments, government buildings. Just use their lobby, big lobbies, to provide a daycare center or a home for the elderly. Look at the government buildings in Wan Chai, the 3 buildings. The question is whether you have the commitment. That's my question. Will you put our demand in your plan? Institutional care is an important element of caring for the elderly. We have heard the views. Before we have the program plan, we have other plans. We know that the waiting time for institutional care is very long. We are working with the welfare sector. Those welfare institutions which have land can redevelop and can, their buildings. I don't want you to do counting of services which are present, but they are not adequate. Will you consult the public on our proposals? We are not talking about additional service. In fact, those on the list have been assessed that they have the needs. Will you increase the supply of service? The program plan will certainly take into account the demand for institutional places, for institutional care service. That's not correct. You just say that, but we say that in the future, we ask that in the future for public buildings, a certain floor space should be earmarked for institutional care service. The program plan will take into account institutional care service. And if we expect that there is a need, then government we will ask for a space to be provided in government premises. That will be government premises will be a major source. We'll continue to pin down on this point. Now you will ask for that unless the government doesn't allow you. Is it the case? Maybe I ask the team to answer the question, to do it objectively. Thank you for the question. As a consultant or research team, we will not have any preconceived ideas as what we will do and what we will not do. We will collect the views. We will put up various recommendations and options. We will list all relevant views. Two members want to give their views. I want to extend another 5 minutes. Well, that can do. Please be precise and brief then. I have heard the views of the groups before concerning services, elderly services. There will be a 3-stage program. Now you will make a report in July 2016. An important element of an important stage is the consensus building. The views of stakeholders are rather divided. How can you build consensus? Dr. Choi. Thank you, Chairman. Now we come to seek your views on stage 1. We have come to seek your view on stage 1, and then we've collected the views. There may be A to Z, 26 categories, and then we will consult on what will be included among the 26 items. How many? What items are considered more important? What items are considered to be less important in coming, say, 5 or 10 years? We will set the order and ranking, but we will not do it by popularity rating, or we will not do it by voting process. That may not be the best way. Concerning healthcare financing or retirement, universal retirement protection, how can you deal with different views? Because the community is divided. Some supports the privatization mode, some are against privatization. On major principles, more time is needed to debate. In the 3rd stage, in public consultation, we hope that more stakeholders can give their views, and we will listen to their views. We have to deal with the motion. I'm not going to speak, therefore, in dealing with the motion, I asked the Bureau by the end of November or December, will come back to give us an interim report. To give the panel an interim report. I will not read out the motion again. You have the motion in front of you. If we just look at social welfare service, then we have shortchanged the elderly. They are not just asking for social welfare service. They want healthcare service and also housing service and retirement service. That extends beyond those issues extend beyond the portfolio of the Health and Welfare Bureau, or rather the Labor and Welfare Bureau. But there is only one government, and we shouldn't limit our scope to such a narrow extent. Is there any objection to the motion? If not, then the motion is endorsed, and then we will give this to the LWB and the Elderly Commission. The meetings are adjourned. Thank you.